Two of my happiest days in my life were in 2009 and 2010, when I gave birth to my two children at a consultancy hospital in Dar es Salaam. But as much as I felt the joy and the dignity of having survived two safe deliveries, I could not forget that 5 years earlier, I was not the woman on the stretcher, but the woman in a white coat, trying to save the life of a woman on a stretcher. But I failed. We all failed. Anna was brought into the labor room while I was working as an intern in that hospital. She was in a very weak state. Her eyes were barely open. She was very pale. Her gown was stained with blood. So my team and I quickly gathered around her, taking her vitals and blood, for we knew she needed emergency blood transfusion. But in the span of like 30 minutes, Anna began having difficulty in breathing. We did everything we could to save her, but all our efforts were in vain. I recall pausing, looking at Anna, lying on a pool of blood, and I felt very devastated from us not being able to save her. She was only 26 years old, and even though I didn't know her, I knew she must have had a whole life ahead of her. So how could she have just died like that? So later on, I gathered courage and got out of the labor room to meet her husband. And I still recall that very painful moment of having had to inform him of the unfortunate passing of his wife of just 1 year. It was so difficult because their baby girl died just a few hours earlier in childbirth. So later on, as I gathered the medical records to certify Anna's death, I realized that she was anemic from the time she was pregnant in the beginning to the end. And her anemia made it very difficult for her to survive following the severe bleeding she suffered after her birth, after the birth of her child. And so, despite all our efforts, Anna became one among many Tanzanian women who suffer due to the severe bleeding after birth that most succumb. Seeing Anna and so many women after that die because of maternal complications was and continues to be very heartbreaking. And so even today, 24 women die each day in my country because of maternal complications. And we know now that more than 90% of these deaths can be prevented using very simple interventions, such as ensuring women attend antenatal clinic early and that any pregnancy danger signs are timely identified and managed, but also using simple medication, such as injecting women with Pitocin immediately after delivery to prevent them from the possibility of bleeding like Anna's suffering. But also using simple medications again, like magnesium sulfate, that would be able to prevent and manage women who may get complications following high blood pressure induced by their pregnancy, controlling infections after birth, and also improving emergency obstetric care. So we know these interventions work. They have been proven to work. So as a doctor and a mother myself, I chose to make the difference because it was the lives of all these women and the death of one that inspired me to do my work. Today, Anna would have been 10 years older and her daughter would have been 10 years. So I do my work for them. Thank you.